3.
Today I'm going to be doing the TB skin test. So I'm going to check the physician's orders, and I'm going to select a well-lit area for testing. And I gathered all my supplies. I have a 1cc syringe, my TB vial, some gauze, and some alcohol swabs. And as I remove my vial from the refrigerator, I'm gonna check the label, make sure nothing is expired, and make sure everything inside looks fine. And I'm going to check the date of that when it was open, and if I opened it, I would write the date and my initials on it. So I'm going to perform hand hygiene and go into the room.
Come in.
Hi, Miss Lewis. I'm Jalen. I'm the nurse. I'm going to be giving you your TB skin test. Is that okay?
Yes, ma'am.
Okay, it's only going to take about 10-15 minutes.
Okay.
Can you tell me your name and date of birth?
Emily Lewis, 7/25/97.
All right. And do you have any allergies?
No.
Okay. And at this time, I would determine the skin test history. And in my email, my patient doesn't have any risk factors. And then I would provide the patient education. So, Miss Lewis, what's going to happen is I'm going to take this syringe and inject the fluid into your forearm, and it's going to make a little wheel, okay?
Okay.
So I'm going to perform hand hygiene, and I'm going to position the patient's arm like this so I can see her whole forearm. And I'm going to put on gloves, and I'm going to go ahead and clean the injection site. Starting from the center and going out in a circular motion. Okay, now I'm going to get another alcohol swab, and I'm going to go ahead and clean the top of the vial, and I'm going to allow both of these to dry. Okay, I'm going to go ahead and get my needle and syringe out and make sure that the needle is tightly secured. I'm going to draw up the right amount of air and inject that into the vial. Okay. And if there are any air bubbles, I would just tap, tap, tap till they go away, till they go to the top. And then I would inject the air out. Okay, I got a little bubble. So I've got all the air out, and I'm going to go to the patient's arm, and I'm going to pull the skin taut and inject at a 10 to 15 degree angle with the bevel up. Okay. All right, there we go. And if it started to bleed, I would just take my gauze and dab around it. There we go. And make sure not to massage the injection site or press on it. So with the needle, I would activate the safety device, and I'm going to throw this into the sharps container, and perform hand hygiene. I'm going to record the date, time, location of the injection site, and the manufacturer, the lot number, the expiration of the PPD solution, and my name. And Miss Lewis, if the injection starts to hurt, becomes really red, starts to swell, you need to contact your provider. And a normal reaction, you're not going to have any of that. Okay.
Okay.
I need you to come back within 48 to 72 hours to have the test read. Okay.
Okay. Sounds good.
And I'm going to give you I'm going to write an appointment card just so you don't forget. Okay.
Okay. Sounds good.
Thank you.
Thank you.
All right, so now you're back for me to check the injection site. So I would gather my supplies. I would get a millimeter ruler, but that was not provided for me in my kit. So I'm just gonna pretend.
Come in.
Hi, Miss Lewis. It's Jalen. I'm the nurse. I'm here to check on your injection from your TB skin test. It's only going to take me about 5-10 minutes. Is that okay?
Sure.
All right. Can you tell me your name and date of birth?
Emily Lewis, 7/25/97.
All right. So I'm going to get you to lay out your arm and kind of flex your elbow so I can see your forearm. And I'm just going to inspect and palpate, make sure there's no positive, and make sure if there's a negative.
Okay.
So I'm going to perform hand hygiene, and I'm going to make sure that I'm on a well-lit surface. I'm going to inspect the site, and I'm going to go ahead and touch the area lightly with the pads of my fingers. And now I'm going to sweep in 2-inch diameter across in all 4 directions to locate the edges of the induration. And using a zigzag feather-like touch, I'm going to palpate the induration. Okay. And I'm going to repeat that with your arm raised at a 45-degree angle, okay? Okay, and without lifting my fingers, I'm going to move my fingers towards the injection site. Okay, and I'm going to locate the induration with my fingertips resting firmly against the induration margin, and I'm going to go ahead and take a ballpoint pen to mark the widest edges from thumb to pinky with a fine dot. Okay, now I'm going to palpate again. Okay, and the dots are in good position. So I would use the millimeter ruler to measure put the 0 on the left dot and then put it out towards the right dot. So mine is going to be 15 millimeters. So this is a positive skin test, and I'm going to go ahead and record that on the form, and I'm going to record the date and time the test was read with my name and signature and the presence or absence of adverse reactions, and then I'm going to explain the significance of the positive skin test to the patient, and tell them that they need to follow up with their provider. And I'm going to provide documentation and a copy of the Manto tuberculent skin test record form, and explain the importance of retaining this information. And if there was any culturally or linguistically educational material, I would go ahead and give that to the patient.